James Tumusime is here, and he would like to talk about access to sexual and reproductive health rights services for our young girls and adolescents within this country. Very good morning, and thank you for joining us, the country director, Richard Uganda.
Thank you, Romeo.
All right. How badly did the COVID-19 pandemic affect our young girls or youth or adolescents during this COVID-19 pandemic before I go into SRHR?
Thank you very much, Romeo, and I think you're just spot on. You know, when we're beginning the COVID and its related effects some time back in March 2020,
Indeed.
we were all unsure what it would look like. Some of us were almost feasting because we were getting a work break.
Indeed.
But
it was fun in the beginning, but then later on,
as it melts out,
reality sets in.
COVID is a marathon that we have to run, and we have to renew our energies day in, day out. It is now 17 months into repeated lockdowns and the closure of schools, the closure of many social amenities, closure of entertainment and music, etc. All these have very grave effects. We have had children restricted from going to school, 15 million to say. 15 million of 40 is actually close to 50% in many ways. So we are a very young country. Many of our people are actually in school, and majority are in the category of primary school, which is the time when people's minds are being formed up. People are learning a lot from interaction. They're learning a lot from being together, learning a lot from the school, from everything around them. So we've had a period where there is a lot of stunted learning. People are not getting in new knowledge that builds them, that progresses them to the next part of their lives. We've had young girls, young boys growing up, and because they are home and redundant, they are becoming big in size and they are not necessarily advancing to the next part of their lives. These are affecting everyone, you know. Again, school is one of those things that runs the economy. School is a very big contributor to the economy.
Especially for agriculture.
For agriculture, for teachers, I mean, for fuel, people going to school every morning, there is traffic jam all the time, but now all those have come down. This means that there is less money moving in the economy. This means that parents are not able to fend for their children. The implications are grave. So before we even talk about reproductive health, there is a lot to talk about mental health. There's a lot to talk about the economy. There's a lot to talk about the whole perception of failure. There is a lot to talk about people feeling that their lives have come to an end, especially young people. Despair. The mental health needs of young people have gone to a very all-time low. You've seen young people committing suicide because they have done badly in the exams. There was a case you aired here from Hoima, etc. So all these are things that not all of them are documented, and the effects are not known for everything.
And the pressure was coming in from family.
The pressure was coming in from family, because the family again is feeling they have sacrificed a lot, and then you're not able to do the best that you can, yet you actually did the best.
It's really callous if someone is going to kill herself and then she says, pinpoints everyone and says, mother, father, Jen, cousin, yes, all of you. All actually contributed to my death because you put pressure on me.
Absolutely. They did not mention COVID in that statement.
She didn't mention COVID.
But, you know, all these are things that are tied together. So that said, Romeo, for me, I speak for Richer Hand. Richer Hand Uganda is one of those organizations that is youth-centered and youth-serving. Our mission is to make sure that we give accurate information to as many young people as possible so that they can make informed life choices and decisions. At Richer Hand Uganda, we believe in young people first. We believe in young people for young people, young people being given the voice. So,
and indeed, you've been doing the most. James Tumusime, I interacted with you on the People's Parliament all the way in December of last year. We went to Kabale, we went to Moyo, we went to Lida, but in Kabale, something callous was actually unfolding. 3,000 pregnancies took center stage in one area of Kabale. Wow. So since December of 2020 and up to now, I'm thinking, hasn't that number tripled or even doubled?
Anything is happening, because in West Nile, in parts of Arua and Nebi, these numbers are even as bad. Wow. You've seen the police report that came out early this year, which was implicating almost everyone around the young girl, the parent, the teacher. Everything is happening here. So there is a lot bad happening.
And all that takes us to the main conversation, James Tumusime, that these pregnancies are attributed to what? Lack of access to sexual and reproductive health and rights services.
Yeah, right. So you see, the issue of sexual and reproductive health and rights is not in many ways at center stage, and let alone if it's for young people. We are looking at the immediate things that are affecting us, the issues of food, the issues of LDUs beating up people. We are not giving the same magnitude to issues of sexual reproductive health as they should be. In our context, our understanding as a youth...
The same energy you used to beat someone, use that exert that same energy to allowing a young person go for some help at a health center.
Absolutely.
As a police officer, don't be like, you young girl, you're only 18. What are you doing going to a health center to get contraception? Absolutely. You're actually killing the young lady.
So you see, if for us at our end at Richer Hand Uganda, we equate sexual reproductive health to any other issue important in development. We equate it almost at the same rating as food. We equate it almost at the same rating as security, because for the country to grow, for the young people, you know, we are now creating a generation which is almost growing in a vacuum of education, in a vacuum of interactive skills, in a vacuum of the things that they need to be able to become the better next generation. If young people do not know about their own life, they are not able to set trends for their lives, they are not able to learn and adapt and pick the best from their environment, they are not able to make decisions regarding whom to associate with, whom to have a sexual life with, whom to have a partnership with, and things are happening. You know, the family itself is overwhelmed at this moment. The parents are not necessarily the most knowledgeable because they are also not, we are not a very literate country in issues sexual health. So the parents are on a learning curve. The schools were playing a very big role in trying to build some of these bridges, but now with everything back home, we have everyone living at home. People are experimenting. Young people are growing, and young people grow with a lot of learning. Learning comes with experimentation. So it should be like a show like this one should be targeted also towards informing parents, towards letting them know
about their role,
about reproductive health as being a normal thing. You know, many parents look at themselves now, but they do not look at themselves at the time when they were teenagers. What were the challenges? There were challenges then, but challenges have even grown now, because right now I'm here on TV, I'm speaking, someone is listening, they're picking pieces and pieces from my communication. We do not know how they'll interpret it. You know, like we say, communication is mine, interpretation is yours. So a lot of misinformation is being pushed out there. Young people are spending time with people that have half-baked information. So
especially on the internet, where they get most of their information.
And now that we have so many e-learning modes happening around, for those that can afford them, they are getting any information that we may not receive. Then there is the other group that have no information at all, the ones in the rural areas that have no access to the e-information. So we need as much as possible to go out, and the platforms that we have for the e-learning should be as integrated as possible, so that we can also speak about basic things like relationships. Whom are you relating with as a young person now that you are in this long lockdown? What is happening? The lockdown will end. It is a marathon, like I mentioned, but then we are aware that humanity always wins. We shall come out of this. What will be the cost? What are the things that we have to put in place now to begin to prepare for the time when all this is behind us? When will this get behind us? It will take a very long time.
A very long time indeed, James.
So we have a lot to do.
But in a bid to get redress to our young people, shouldn't we maybe explain for them what their rights are?
Of course, it's important for the rights to be explained, but also the responsibilities in equal measure. To say that
as a young woman, what are my rights?
As a young woman, it's your right to have information. It's your right to ask the questions regarding your growth. It's a right for you to go and ask a health worker for the services that you need or for the information that can propel you. It's important for you to enter healthy relationships that you're free to communicate about, that you can talk with to your peers, you can talk with to your parents, etc. You have a right to go to school, but now school is closed. So what is the alternative that you're doing with your time? What are the support mechanisms that the parents who are your most immediate putting in place? So this is a challenge to the parents. The government is trying what they can. Everything is getting hard for everyone. But these rights come also with the responsibility that, again, after giving you information, you should know that the life is yours. The parents should know that they are breeding a person of their own, a person that will come in their own right. So we need a lot of responsibility positioning for young people, for them to avoid early pregnancy, early sexual intercourse, for them to listen to their parents and be useful in terms of doing alternative work that is...
You're forgetting the most important one, James.
Which is?
You have the right to say no.
You have the right to say no, absolutely. Thank you very much, Ramil. Yeah.
Go ahead.
Yeah, so you have the right to say no. It's your responsibility to say no. You know, there's a lot to talk about.
There's a lot to talk about, but then let's talk about the factors that are impeding access to sexual reproductive health and rights services in Uganda.
There is a lot of factors. One is the gender stereotypes. If you look at this lockdown, it's really brought this very high for the people to know that if we are all broke, our home has no food, this girl can go and get food for us.
And it's happening.
And it's happening a lot of places. For them to say that we now need some dowry so that we can live these few days of lockdown, that's happening a lot.
Not even dowry. A parent will just say, can you just go out and look for some money? We need some food.
We need some food. And
the mother doesn't know how the young girl is going to do it. She just wants the girl to go out and look for some money. And the girl will indeed come back with money. But prostitution has been rife. And I believe because of the reports we've been getting, parents are also colluding with the criminals.
Absolutely.
Selling their children.
Absolutely. So all these are things that are happening. And, you know, of course, once we go to the health facilities, are the essential services that young people need, especially in the sexual reproductive health arena, present. Of course, the lockdown that limited the movement of people. People are not able to freely move, and you know it's very hard to explain to the security forces that I'm going to get a contraceptive. So I'm happy that the president has come out most recently to speak about these human rights violations, and I hope that moving forward, this will be an opener for people to be able to move within restricted spaces, to be able to access the most core and basic things that they need to move their lives, and they can speak freely and express themselves.
Well, it's been a chorus from the president, but we do hope he'll be walking the talk. He's been talking too much and less biting. We need to see the president biting this time around. Go ahead, James.
Well, that's not mine to say, but I'm happy that he's spoken about it. And from where we sit, that gives us comfort because we speak for essential services. We speak for services that are not necessarily of people that are about to die. You know, we speak for services that are for futuristic. Contraception does not make its most impact there and then. It makes its impact later. Speaking to young people and telling them about testing for HIV, testing for diseases like other sexually transmitted infections does not affect them immediately, but affects them later. So we think that this communication should be on media like we are doing right now, and we think that our Ministry of Health should rally more partners to work with the Ministry of Education as we go into a school opening phase. These are things that we need to plan and integrate within the most immediate. We need to desensitize the children that have been for this very long break to come back to a learning mode.
James Tumusime, there's also misinformation that has been rife over these contraceptives. People saying they cause too much bleeding, they do this and that. Let's just break down some of the misinformation that has actually bogged the access to sexual and reproductive health and rights. You also do have the religious leaders and cultural leaders who are very much against contraception. They are calling for abstinence, but we are looking at a situation whereby a young girl has been defiled or raped. How can they abstain in that situation? They might need a pill to avoid pregnancy, they might need a pill to avoid HIV and so forth. So such attitudinal challenges. Also the health workers. When they see a young person entering a health center to get some help, they'll look at them like, oh, you're 18 and you also need contraception, or you're also having sex. It happens too much to the PWDs.
Yeah, thank you, Romeo. You've opened up a Pandora box, they call it.
Indeed.
I think contraception in itself is not the issue. The whole issue is around to know and set limits, to understand what our aspirations are as an individual, as a family, as a nation. The aspiration to abstain is a very important one, and I strongly believe that for the young people that still fall under the curve of where they can be able to abstain, the family structure is supportive. That is the first and most precious thing that we should promote. But then there are many young people that have also found themselves in incestuous relationships in the homes. The young people that have gone out to survive, get food for the home. All these are things that we need to be looking at and putting into perspective. So we need to put out as much information. It's not in my place to speak for the ills or the goods of contraception, but it's in my place to speak for awareness on reproductive health. It's in my place to speak that we should be putting ourselves in positions that prevent disease, in positions that prevent pregnancy for young people.
Unwanted.
So the health workers have an obligation to provide the most of this information to the young people that so seek it.
And not discriminate them.
And not discriminate them. The health facilities, the pharmacies are places where all these services are available. So we need to conscientize ourselves to say that we are already 40+ million people, with about 50% below 15 years old. Now, the people who are below 15 years old are people at home and they're also making babies. If you're 15 and making babies, what are you putting out there? Who is going to take care of your children? What is the social and economic value adding to the economy? So then, after answering those questions, the National Planning Authority has been very useful to guide us. We should be able to then speak into the Vision 2040, where we are putting family planning, education, skilling, all as alternative tools to make sure that we control and create a quality population. We do not want to have young people, I mean, we now need to look at alternative education. If young people cannot go to secondary, senior 1, senior 2, etc., can we have alternative skilling programs? The government has been open to those. Can this be promoted more to give an alternative pathway?
Take use of those social workers.
Yes,
go ahead.
Absolutely. So we need young people to learn the so-called yoga program. I'm happy that the parliament is picking it up. These are things that need to be strengthened. The vocational skilling, to create alternative pathways for those that for any reason are not able to go back into the main schooling system. So a lot
I
has
got
to
pregnant as a teenager, so I'm out of the school system. But after having my child, I would like to get back into the school system. Not in senior 5, but I would just go and get some vocational skills.
That can work for you.
Because I feel I've grown up. But then, what is the role of the religious and cultural leaders when it comes to impeding access to the sexual reproductive health and rights services?
I would not want
they've been denounced.
I would not want to speak about religious leaders in the role of impeding access.
But do we need them on board?
I would love to speak about them more in the role that they can play to make sure that they promote access to reproductive health as a key priority, access to safer communities and safer homes. I would love to speak to religious leaders in the note that they own in terms of Uganda. We have a lot of school and health system that belongs entirely to the religious groupings. So for me, the acceptance to face evidence and use evidence to speak about the next course of action. I do not know if the religious leaders will take my school of thought per se, but I know that we all want a safer Uganda, a Uganda where young girls are girls and in school.
James Tumusime, Country Director, Reach a Hand Uganda, thank you very much for having made the time to acquaint us with this very important information. Well, of course, we do have another conversation in the offing. It's related. We want to talk about the rising cases of gender-based violence during this COVID-19 pandemic and the consequent lockdowns that ensued. We'll be right back.